Head of National Emergency Medical Rescue Team and Vice President of First Affiliated Hospital of Zhengzhou University, Mr. Zhao Song. And also, we have the Party Secretary of the First Affiliated Hospital of Hainan Medical University, Mr. Cai Yi. Vice Director of Hubei CDC, Mr. Li Yang, and they will brief you on the current situation in the Midship Hospital. First, we would like to give the floor to Mr. Li Yang on the update of the epidemic situation in Hubei Province. As of 29th of February, the accumulated cases in Hubei, 66,907, 49,121 in Wuhan, accounting for 70%. And in other cities, it's about 17,785. Wuhan, Jianghan, Jianghan, Xinzhou, Suizhou, Xiangyang, and Huangshi. Altogether, 8 cities have over 1,000 confirmed cases of COVID-19. On 29th of February, the new confirmed cases in Hubei Province, 570, accounting for 99% of the national confirmed cases, within which 565 in Wuhan, and in other cities, 5 cities accounting for 1% of the total confirmed cases in the Hubei Province. Xiangyang, Yichang, Jinzhou, Xiaogan, Xianning, Suizhou, Enshi County, Xiantao, Tianmen, Qianjiang, Shenongjia. 11 cities have no new cases. As of February the 29th, 2020, 28,912 people are hospitalized, over 5,000 in critical condition, accounting for 25% of the total hospitalized patients. As of February the 29th, total death, 2,761. 26 in Wuhan, accounting for 76% of the total figures in Hubei Province. 31,187 patients have been discharged from the hospital as of February the 29th of 2020. And for the discharge for 29th of February, 1,675 patients discharged from Wuhan City, accounting for over 70% of the total province. That's the update. Thank you. Now let's give the floor to Mr. Shen Hui to update their work in Midship Hospital in Jianghan. And also, he will brief us on the cooperation between the medical teams. Good afternoon. For Jianghan Midship Hospital, located in the Wuhan International Convention Center, and started to be renovated from February the 3rd, and started to receive patients by February the 5th. The Midship Hospital was taken over and operated by the Union Hospital of HUST. The total number of beds is around 1,500, and we have over 20 medical teams across China to support the Midship Hospital of Jianghan. As of now, we have 1,153 medical workers in Midship Hospital, so we have the large number of beds in the Jianghan Midship Hospital, and also we have the most number of discharged patients in Wuhan. In order to ensure an efficiency of the operation, we have focused on 3 areas and built several mechanisms to facilitate the operation. First, we focus on 3 key links. We started to receive patients at an earlier stage, And we will also receive the instruction from the Hubei Provincial Steering Group. So on the evening of February the 5th, we have already received 684 patients for less than 4 hours. And at the same time, we're also focusing on the treatment. We strictly abide by the treatment plan and make an accurate judgment and diagnosis of the patients. And if some patients develop severe conditions, that we will start the process to transfer these patients to designated hospitals. At the same time, we are also focused on the discharge of the patients. One of our advantages is that we will have all the resources that are coming from the Union Hospital of HUST. We will run NAT, the CT imaging, and also the blood test for these patients. So these patients have to meet all the national standards in order to be discharged from the hospital. As of 24-hour 29th of February, the hospital have conducted 4,570 NAT tests, and also we run 2,052 CT tests, and also we conduct 2,900 blood tests for the patients. At the same time, we're also building 3 coordination mechanisms. First, we're working with the municipal government. We are under the unified guidance of the Union Hospital of the HUST. And we have received strong support in terms of the medical resources and supplies. At the same time, we are working together with the Jianghan regional government. We have focused on the detailed implementation of all the guidance. If we detect the problems, we will spare no efforts to resolve these problems as soon as possible. And also, we have formulated a guideline and a treatment plan in the Midship hospital. And also, we are organized a series of meetings and working with the experts to make sure that different medical teams can form a strong synergy. Third, we also have a coordination mechanism between the doctors, medical workers, as well as the patients. The party committee has played a key role in this process. And also, we are conducting the online diagnosis and the online consultation to educate the public about the epidemic situation. And also, we have formulated an expert group. And also, the patients will also organize a makeshift community so that they can communicate with each other and provide feedback to our steering group. With the strong leadership of the Union Hospital of HUST, together with the joint efforts from different medical hospitals, we have received 1,830 patients, and 932 patients have been discharged from the hospital. And we will not relax. We will keep up with the good momentum with high morale and complete the task assigned by the CPC Central Committee. Let's give the floor to Mr. Li Xuewen to update the work on Shanxi Medical Rescue Team. Good afternoon. The Shanxi National Emergency Medical Rescue Team arrived in Wuhan on February the 5th, and they started the work immediately upon arrival. We have 15 doctors, 15 nurses, and also senior experts engaged in the work. And all of these medical workers have very rich experiences. So we have people from different disciplines joining for the medical rescue. At the beginning, we are taking over the wards together with other medical teams from different provinces. And later on, we went to the makeshift hospitals and take over 270 beds. Now we are at a critical stage, and the makeshift hospital has been playing a key role in both treatment as well as isolation and quarantine. We follow closely on the changes and evolution of the patients' syndromes, and at the same time, we are also doing a lot of work to provide psychological counseling. For the nurturing group who are working at the makeshift hospital, they are actually formulating a procedure for the admission, treatment, as well as the discharge. By doing all of that, we can make sure that we can have a more effective procedures that provided to the patient. And on February the 12th, we also sent out a team to Jianghan Stadium, another makeshift hospitals, and we are providing some guidance and support to the teams that have been based in the stadium. We are also communicating with them about some of the working procedures on receiving and discharging the patients. So when Vice Premier Sun Chunlan gave an inspection to the stadium, she fully acknowledged our work. For the makeshift hospitals, it takes less than 24 hours for the completion and the receiving of the patients. And the Jianghan makeshift hospital also have a very high discharge rate. Going forward, we will continue to follow closely on the instructions from our leadership, and also to make sure that we can win the battle against the COVID-19. Now, I would like to give the floor to Mr. He Qiang to give us some update on the work of National Emergency Medical Team from Zhejiang Province. After received the notification from NHC, within short time of preparation, we have arrived in Wuhan on February the 14th. We have a large group of doctors, nurses. Also, we have some engineers participate in this operation. This time, we are racing against the clock to assist Wuhan, and after we arrived in Wuhan on February the 14th, we immediately start our work in the Wuhan Jianghan makeshift hospital. And also we are formulating a series of procedures to facilitate our work. And also we are heading to Huangpi to facilitate the renovation of Huangpi Stadium into the makeshift hospital. We also have a very strong execution in our work and very strong capability in the treatment. And I myself also be appointed as the president of the Huangpi makeshift hospital. And leading other medical teams across the nation, we also formulate a lot of procedures to build the makeshift hospital. And on the February the 25th, we are also going to the Guanggu makeshift hospital to provide guidance. And in many areas, we are providing a lot of experiences, and also we are setting up 2 CT rooms so that we can run CT tests for the patients all day long. Per instructions, we are also transferring ourselves to Caidian makeshift hospital. Thank you. Now I would like to give the floor to Mr. Zhao Song to bring us on the work of Henan National Emergency Medical Team. Friends from the media, good afternoon. Henan National Emergency Medical Team established on 2012 and accepted by NHC by 2014. This is the only national emergency medical rescue team in Henan Province. Since our establishment, we have conducted a lot of field trips and practices. We have very rich experiences in the treatment. And on the 24th of February, we also have a group of medics, which it is around 33 people that are coming to Wuhan for national assistance. And this is also our third batch of medical resources coming from Henan to Hubei Province. Among the medical workers, 9 people have a senior certification, and also 23 are party members. And also we are bringing the commanding vehicles, utility vehicles, camping vehicles, altogether 7 multifunction vehicles. Upon arrival, we immediately establish a CPC party committee so that we can make sure that all the party members can shoulder responsibilities. By taking the task in Jianghan Midship hospitals, we can make sure the party flag fly high in Wuhan. So the first batch of the medical team will take charge of 400 beds in the Jianghan Midship Hospital. In total, we have received 516 patients, accounting for 28.2% of the total admitted patients, and the discharged patients is about 253, accounting for 27% of the total discharged. And also we run 872 CT testing for the patients, accounting for 42% of the test. So for the Midship Hospital in Jianghan, we realized 0 infection for the medical workers and 0 death. And now we are able to have enough beds so that we can wait for the patients to come for rescue in Midship Hospital. And some of the patients, they are sending out posts on social media to extend their appreciation to the medical workers. In the afternoon of February the 21st, Vice Premier Sun Chunnan visited Jianghan Midship Hospital and showed care to the medical workers, and which is quite encouraging for all of the medical workers. All of them are showing a strong determination, confidence, and capability to win the battle against the COVID-19. Thank you. Now I would like to give the floor to Mr. Cai Yi to give us some update on the work of Hainan Emergency Medical Team. Friends from the media, good afternoon. As of now, Hainan has dispatched 7 medical teams to support Hubei Province, comprising of 864 people. 586 medics are working in Wuhan. For Hainan team, we received the instruction from NHC on February the 3rd. We gather ourselves and bring our resources and the medical equipment and head to Wuhan. We have arrived in Wuhan on February the 5th after 39 hours, over 1,400 kilometers. We are coming here to fully take in charge several wards of the Midship Hospital. We are also organizing a multi-functional group that are coming to assist the Midship Hospital. There are over 10 disciplines and departments are participating in this mission. Jianghan Midship Hospital is one of the first Midship hospitals that are being put into place. At the beginning, we have a lot of heavy duties. We are working together and surpass all of those difficulties. The Midship hospitals targeting the patients with mild cases. So some of the patients, they may have some psychological issues. We have professional psychological counselor. They can provide some assistance to these patients. And some of our medical workers, they are organizing an exercise team for the patients. So they're doing squaring downs and welcome the participation of these patients, which can help these patients to recover and alleviate their symptoms. And also, we organize the detailed procedures. So for each shift, all of their work are clarified and defined. Especially, we have very detailed on-duty list. And for some of the patients which may have a severe situation, we will collect their data and also have a group discussion to understand the situation for these patients. And we also prepare the treatment plan earlier. So by doing that, we can early identify patients with severe condition that we can transfer these patients. And for all of these patients that are admitted by our medical team, 70% have been getting out of the Midship hospital. Now is the Q&A section. Before I raise the question, please identify yourself first. So for the Midship hospital, it has already received over 1,800 patients. So what problem have you been solved for these patients? So can you tell us the role of the Midship hospital? Thank you. Thank you for your question. It is a good question, and we're all concerned about the role of the Midship hospital. At the beginning of the operation of the Midship hospital, we are also concerning these issues. Midship hospital was generated at an exceptional time. It is unprecedented. But with the successful operation of the Midship hospital, we can say that this kind of Midship hospitals play a key role in containing the epidemic. It also shows the policy advantage as well as the Chinese wisdom. There are several key functions for the Midship hospital. I will summarize as 3 functions. First, we effectively control the infection source so that we can curb the spread of the virus. It can help us to contain the virus effectively. Also, Midship hospital, as you can tell from the name, it is a hospital. And for the patients after they are being admitted, they can receive a very technical and professional treatment from the doctors. With all of these diagnoses and treatments, the majority of the patients can be recovered. It actually reduces the transmission rate and also can alleviate the symptoms from the patients of mild cases. And if we found some patients, they may develop some severe conditions. For these people, we will work together with the designated hospitals and transfer these patients to those designated hospitals. So by doing that, we can reduce the mortality rate for those patients. I have heard some of the introduction from the leaders of the National Emergency Medical Rescue Team. We are quite curious about the main function of the National Emergency Medical Rescue Team. Can you tell us more about that? Thank you for your question. I will answer your question in three aspects. First, the National Emergency Medical Rescue Team, it aims to improve the nation's capability in handle emergencies. And all of these medical team will be assigned and accepted by NHC. So for each one of the medical rescue team, it will have 10 vehicles, multifunctional vehicles. So for example, we will have the operations vehicle, utility vehicle, and also some camping vehicle, as well as the communications vehicle. So by using all of these different kinds of vehicles, it can form a temporary hospital. And second, it is actually one of the key tasks that was identified by the 13th Five-Year Plan to establish such a national emergency medical rescue team. Altogether, this time we have 22 national emergency medical rescue team, and they have played a key role in facilitating the operation of the Midship hospital. Third, for Hainan National Emergency Medical Team is a little bit unique. Because we have a special medical rescue vessel which can be operated on the South China Sea. And we also are participating in some of the operations that was happened in the South China Sea. And also we have our helicopters so that we can conduct the rescue work on the land and on the sea. And this time we actually bring all of our medical resources and come to Hubei and come to Wuhan for the rescue work. And for Zhejiang National Emergency Medical Rescue Team, used to participate in some international operations. And we also participate in a lot of national projects for the rescue as well. Shanxi's team was established in 2012. We'd also participate in a lot of rescue work, for example, the landsliding, etc. And it is the first time for us to participate in a rescue for infectious disease. So by carrying out the operation this time, we will learn from the teams from other cities. This is the general situation from the Shanxi Emergency Medical Team. For Henan National Emergency Medical Rescue Team, was affiliated of the first affiliated hospital of Zhengzhou University. It is also the only one national emergency medical team in Henan Province. In the past, we conducted rescue under natural disasters, and it is also our first time to participate in a rescue work for infectious disease.
我是山西广播电视台的记者，我的问题是，医院的感染管理呢，一直是这次疫情防控工作中很受关注的一个问题。那请问山西国家紧急医学救援队是如何根据方舱医院
For the hospital-acquired infection management, it is also of a public concern. This question is to Shanxi Bethune Hospital. Can you tell us more about the nosocomial infection management? Thank you for your question. For Midship Hospital, it admitted a large number of patients with infectious disease. It is a daunting task for all of us. We have to attach great importance to reduce the transmissibility of the virus, especially for the virus transmitted to the hospital and the medical workers. So this time we could see all of these makeshift hospitals are actually renovated from some stadiums, convention centers. Due to a strict time limit, it's very difficult to make sure that all of these hospitals are up to the standard so that there will be no hospital-acquired infections. So we have to find a way to protect our health workers. First, we will find out some vacant spaces so that we can set up some isolation, especially the 3 areas, 2 passages. And for different corridors, we will set up barricades so that we can make sure that the different groups of people can be quarantined and isolated. And when necessary, we have to break down some walls to make sure that the contamination areas can be separated. And also, we will also focus on the staircase to make sure that the hospital-acquired infection can be reduced to the minimum level. And also, we will set up the temporary passage so that we can consider those areas as a buffer areas. The ultimate goal is to separate the contamination areas with the semi-contamination areas. When necessary, we will also set up temporary tents, especially for makeshift hospital that does not have sufficient space. So we would like to set up temporary tents so that we can separate the different areas. At the same time, we will provide more HAI education to the medical workers so that they could raise their awareness. My question is to the head of the National Emergency Medical Rescue Team, Mr. He Qiang. And this time, as to my knowledge, the Zhejiang National Emergency Team has been working in 4 different makeshift hospitals. So, what is your comment on that? And it is the first time that the country has established the makeshift hospital to treat the COVID-19. So we have continued to develop the makeshift hospital to the better. At the beginning, we're not familiar with the procedures of the Jianghan makeshift hospital. We are conducting our work. At the same time, we are learning about the procedures about the makeshift hospitals. During this process, and our medical workers also provide a lot of suggestions and feedback. So as of now, the NHC has already provided the 3rd version of the operation of the makeshift hospital, and also the patient management also have a very good procedures. For my medical team, they have been working in 4 different makeshift hospitals. We have very good understanding about the functionalities of the makeshift hospital. And I would say this time, makeshift hospitals have played a key role in combating against the COVID-19. If we do not have such a makeshift hospital, that a lot of patients with mild cases, they cannot be received to the hospitals, so that the infection will be more severe and more patients with mild conditions will be turned into severe conditions. And if we have more makeshift hospitals, we can save some of the beds for ICUs, that we can save more lives for patients with severe and critical conditions. At the beginning, we have a large number of patients receiving Jianghan makeshift hospital, and later in the Huangpi makeshift hospital, it also accumulates some of the experiences of the Jianghan makeshift hospital so that they can experience a better performance. We're pretty much concerned about the medical workers who are working at the front line. So I would like to understand what measures that's been taken by Henan to protect our medical workers. Thank you. Thank you for your question. I would like to answer your question in 6 aspects and also brief you on the work on the protection of medical workers. When we are forming the medical team, we have put medical workers' health and safety as the top priority. We also assigned experts with rich experiences to join our team. And second, we have very strong logistics support. At the time of our departure, the head of Henan NHC leading the group and they have been sending out a message clearly. Though we have limited medical resources in Henan Province, but we have to make sure that the medical supplies and resources are adequate for the Henan National Emergency Medical Rescue Team. Per request, we also send out medical resources to Wuhan on a regular basis, so we can lay a solid foundation that we will realize a zero infection for medical workers and win the battle against the COVID-19. At the same time, we are providing a lot of trainings to our medical workers so they could better protect themselves. At the beginning of the outbreak of the COVID-19, in our hospital, we also organized an expert group. They have providing a lot of trainings and protection to our medical workers. And we are also organizing some field trip drills to make sure that people who are about to work at the Midship hospitals understand all of these procedures and methods to protect themselves. Also, we closely follow the conditions and situation of the people who are working at the Midship hospital. We have 4 shifts for all the medical workers each day. And the experts of infectious disease also work closely with these people. And we will check the quality of all of those protective gears. So we have to make sure that all the protective suits and goggles and masks are up to the standard. If there are some potential risks, we will use our backup gears and we will provide guidance to the medical workers to make sure that these people will not be infected. Also, we have a one-to-one guidance to the medical workers to make sure that they can stay safe inside and outside of the Midship hospital. And also, we have a strict management for different areas of the Midship hospital. We have formulated a detailed plan. Make sure that we do not have any cross-infections between the medical workers. In order to reduce the risk for cross-infection, we also have a contamination areas and semi-contamination areas, and also we have a designated personnel to disinfect those areas. 6. Also, we ask our medical workers do not gather during lunch or during dinner, because by doing that we can reduce the risk of the cross-infection. With Hainan Daily, so I understand that there are some professional psychological experts who are working for the Hainan National Emergency Medical Rescue Team. Can you tell us more about this arrangement? You're right. For the National Emergency Medical Rescue Team of Hainan, we have a professional psychological counselors. At the beginning, we have a lot of difficulties in the Midship Hospital and a lot of workload for our doctors. So at the beginning, these doctors may under a huge pressure. And for the patients, they're actually leaving their families and being admitted to the Midship Hospital. They're not getting used to the environment. And they do not have a sufficient understanding. They also panic about COVID-19. They're full of anxiety when they're being admitted to the Midship Hospital. All of this will bring negative emotions for the patients as well as the doctors. That's why these people all need psychological counseling. And this time we are under a big pressure, and also we have to stay in the Midship Hospital for a long time. That's why this time we equip some of the professional psychological counselors to work together with us. So for the emergency team, if we have some professional psychological counselors, they can provide service to the doctors and the nurses who are working at the front line. For our emergency team, each time where we inspect the wards, we will also provide some psychological support to the patients. For some of the patients, they may be extremely anxious. When we are comforting these people, we will also arrange a one-to-one counseling between the patients and the professionals. And also sometimes some of our doctors are suffering from insomnia and they're also under huge pressure, and these people will also need to seek medical support from these psychological counselors. And also our leaders have been considering that there may be a heavy workload for the frontline doctors. So we also have a backup all-night group, so they can provide a 24-hour counseling for all of the doctors and the patients. Last question. I believe there are a large number of patients and the doctors in Jianghan makeshift hospitals. It is very difficult to reduce the cross-infection. Can you tell us what measures have you been taken to reduce the risk? Indeed, this is a very important issue. I also attach great importance to this issue. As I've just said, for the nosocomial infection, management is very important for the makeshift hospital. Especially for the makeshift hospital, it has a large number of patients as well as the doctors. First, I will talk about the firefighting issues. At peak hours, maybe we will have over 1,700 people gathering in the makeshift hospital. And some of the patients, they will also bring some thermal blankets and some of the thermal bottles. So all of them have to use electricity so that we may have some risks for the firefighting. So that's why for the government have arranged a great number of extinguishers at designated places. And also we will make use of the broadcast to educate people who are inside of makeshift hospitals. And also we are conducting a lot of drills to make sure that the firefighting risk can be contained. We're working closely with the securities, and we inspect the hospitals at a regular basis so that we can detect the risks at an earlier date. And also we have a very good communication between the doctors and the patients. And our psychological counselors also provide a lot of support to the patients. We also have some volunteers who can provide some guidance to the people who are living under the makeshift hospital. And also, for the food and meals, they're also very important for people who are from the makeshift hospital. We also have a food safety committee, so who can supervise all of the procedures for producing the food and also the delivering the food. And for the doctors and medical workers, they will ask about the situation of the patients on their digestive situation, so to make sure that there will be no secondary disease generated.